Thank you so much. Dr. John Ward, Director Coalition for Global Hepatitis Elimination. Professor Harvey Alter, distinguished ministers who are sitting here. Ladies and gentlemen, I want to express my sincere gratitude to the United Nations Group of Friends to Eliminate Hepatitis for convening this very, very significant gathering. We have come together to address our pressing issue, strengthening political commitment and global solidarity for hepatitis elimination, hepatitis service integration via universal health coverage. This initiative, led by the Permanent Mission of Egypt to the United Nations, plays a pivotal role in mobilizing political support and advocating access to hepatitis prevention, care, and treatment. It serves as an important platform for sharing information, best practices, innovative models, and lessons learned, fostering a collaborative approach to tackle hepatitis worldwide. The objectives of the group of friends align perfectly with the overarching theme of United Nations General Assembly 78, focusing on rebuilding trust and rekindling global solidarity to accelerate progress on the 2030 Agenda and its Sustainable Development Goals, aiming for peace, prosperity, progress, and sustainability for all. Ladies and gentlemen, today, Pakistan stands at a crucial juncture in the fight against hepatitis. According to the estimates that we have, around 12 million people in Pakistan are affected by hepatitis B and C, with 150,000 new cases reported every year. The challenges stemming from unsafe blood transfusions to unhygienic dental treatments to reused syringes are multifaceted. The recent data underscores the gravity of the situation, with increasing HCV rates and steady HBV prevalence. In 2022, the Coalition for Global Hepatitis Elimination launched the National Hepatitis Elimination Profile Initiative, a remarkable effort aimed at expediting our journey towards hepatitis elimination. Under this initiative, the government of Pakistan has set an ambitious target aiming to screen millions of individuals and treat millions affected by hepatitis by 2030. However, this program requires adequate funding to become a reality. Pakistan is committed to addressing these challenges and moving closer to our hepatitis elimination goals. Our response to the COVID-19 pandemic has enhanced testing capacity, improved electronic health reporting, and strengthened coordination among provinces and the federal capital. Some provinces have initiated reporting of diagnosed and treated cases as well. Pakistan deeply appreciates the pivotal role of the international partners, particularly Gavi, in the fight against hepatitis. Gavi has contributed expertise and resources, enabling Pakistan to address this challenge effectively. The collaboration has led to healthcare infrastructure, heightened public awareness, and enhanced healthcare infrastructure. Pakistan's partnership with Gavi, the Vaccine Alliance, primarily focuses on immunization and strengthening healthcare systems in the battle against hepatitis. I'm on the last page. Furthermore, Pakistan has formed partnership with the corporate sector through the Corporate Coalition for Viral Hepatitis Elimination in Pakistan. consisting of 12 leading companies. These alliances strengthen our resolve to eliminate viral hepatitis by 2030. Successful HCV micro-elimination programs have been implemented in both the public and private sectors, demonstrating our commitment to results. Looking ahead, our priorities include updating the National Strategic Framework, improving surveillance, expanding hepatitis B birth dose vaccination, increasing HCV testing and treatment, and engaging community-based organizations. These steps will bring us closer to eliminating hepatitis as a public health threat by 2030. I want to assure you that Pakistan remains steadfast in its determination and dedication to addressing the challenge of hepatitis and achieving the World Health Organization's global elimination targets by 2030. We are committed to building strong partnerships, both domestically and internationally, to ensure the success of our hepatitis elimination efforts. Together, as a global community, we can and we must eliminate hepatitis, securing a healthier future for all. But before I say thank you, I want to thank Dr. Nidali, who facilitated my presence here, and WHO, which has been doing a wonderful job by demonstrating its leadership across the globe. I used to be Pakistan's permanent representative to the United Nations in Geneva, and there I worked with very closely with WHO and WHA. Thank you so much, ladies and gentlemen.